Good afternoon, everyone. My name is Dr. Hynes, and today, in conjunction with my colleague, Reid McDermott, we will speak to you about using team-based learning combined with visually enhanced mental stimulation to promote clinical integration of physiology content for our first year medical students. So, if we want to talk about the purpose of this particular development of this program, then we can start with the fact that no curriculum should ever be static, and that a curriculum should always be developing and changing, and both in its content and in its mode of delivery. Any robust curriculum will be informed by many different factors, and that way we can ensure that we have continuous curricular improvement. In this case, there are probably 6 major factors that contributed to the design of the program that we're going to talk to you about. If we start with the first major input, was that the Medical Council of Ireland have placed an extreme emphasis on the importance of preparedness for practice and the ability of a newly graduated medical student to integrate into a medical team. Now, if you want to do this, then we must develop a curriculum to support this preparedness for practice. Now, simulation and the simulation methodology is well known to be an excellent teaching method to support this aspect of student education. However, because we have large class sizes in excess of 200 in each year, and with projected increases in student numbers, the delivery of simulation within the early years of the medical program is challenging to these large numbers, and this has to date resulted in simulation being restricted mainly to the clinical years. Other key factors to this curricular improvement and the development of this program include the inclusion of true vertical learning and true vertical integration of knowledge. In this case, we would like to deliver the biomedical sciences and to contextualize their knowledge by delivering them embedded within clinical cases in an environment that reflects students' future working environments and places and practices. This teaching the science in context and in conjunction with early patient contact and the delivery of the patient's view and the patient's journey will improve and promote retention of knowledge, skills to be further developed throughout the clinical years. So all of these factors play into the development of curricular improvement and the development of our ASK program. So the ASK program, what is it? Essentially, what the ASK program is a 5-step program which involves the delivery of the biological sciences in a clinical context. So the first step in this program is the case presentation. In this case, prior to student involvement, cases were developed that promoted active learning. So these were stage appropriate. The students would be familiar with some of the terminology, and they would be based on the material that was being delivered within the physiology modules at the time. So for example, in the respiratory case, the module being delivered at that time was respiratory physiology. The case was developed and then it was delivered to the students as an introductory session, which involved both a scientist and a clinician. Students were allocated into groups and then they were given a case booklet. In that, they had to then go and they had to work both independently and in their teams. So the student learning involved independently learning the terminology, the basis of the case, And then they had to meet together to discuss their view of the case as it had been delivered to them. And this was absolutely essential. It fosters teamwork. It was necessary then before students could actually go on to step 2 of the program. In step 2 of the program, the students met with their patient. Now these patients, again, the development stages, the patients were recruited via public and patient involvement network and other methods, and they were case matched to the 2 cases that were being delivered this year. The student then met with this patient, but it was a patient-led session. They told their story to the patient, to the students, and the journey through their illness. And this really fostered, the communication skills of our students. They asked questions. They were interested. It stimulated their interest in medicine and their interest in meeting patients, asking questions. In step 3, immediately after they had met with their patient, the students were then introduced to the case through the eyes of a junior doctor. So again, prior to this, cases were given to 2 interns, recently qualified doctors, who developed a video. And they produced this video based on both the case information and also all of the information from the lectures that were being given by Physiology at the time. The video was released to students who then had to, both independently and as a team, review the video. And you can see here some slides of the parts, snapshots of the video with our 2 interns in the top right hand corner, which is the respiratory simulation, and for example showing them about an X-ray. This allowed the students to realize the importance of how science informs clinical practice, and it allowed them to see it not just as something that they read about in books, but from a career progression point of view, how it would be delivered to them when they are newly qualified and what was ahead of them in their years ahead. The next step, which was step 4 of the process, involved a senior clinical consultation. Again, in advance of the delivery of this part, for the 2 cases, clinical consultants who had knowledge of the actual cases and expertise in areas like critical care and renal medicine met with the students for a questions and answers session. And that's the important part about this. It wasn't just a clinician speaking and rereading what was there in the slides and what the students had already learned. Students had learned prepared questions, and it was an interactive question and answer session which allowed the students to get a more detailed knowledge of the clinical aspects of the cases. It also enabled them to communicate with their senior colleagues, and it encouraged them to think critically about the information they'd been given and how that might be applied in a clinical setting. After this, students then were ready for step 5. And step 5 involves the actual simulation session for each of the cases. And my colleague Bronwyn will walk you through this stage of the programme. Thank you.
Thanks, Ailish. So my name is Bronwyn and I'm the Senior Technical Officer in Simulation for the School of Medicine at NUIG. And I'm going to talk you through the final element of the ASK programme, which involved a simulation session that used the Visually Enhanced Mental Simulation, or VEMS technique, and team-based learning. So just to get us all on the same page, here are some definitions to start off. Mental simulation is a type of simulation in which the individual mentally practices a task without physically doing it. So they work in a stepwise manner through the technical and behavioural skills they would apply in a particular situation. VEMS, or Visually Enhanced Mental Simulation, is an interactive mental simulation. So it's a team-based approach using the representation of a patient and equipment combined with thinking aloud. Team-based learning then is an active learning and small group instructional strategy that provides students with opportunities to apply conceptual knowledge through a sequence of activities that includes individual work, teamwork, and immediate feedback. So what does this look like in action? Students worked in groups of 5 and attended 2 simulation sessions where they worked through a renal and then respiratory case. A 5-foot-tall printed board with a photograph of an elderly female was printed to represent the patient the students were caring for. The boards had a whiteboard finish, so that allowed students to write and draw information as they worked through their case, and the board could then be cleaned down and reused between groups. Each group were given real pieces of equipment for vascular access, blood pressure measurement, oxygen delivery, and so on to support cognitive activity and increase their imagination and team discussion. Students worked through the case in the following manner. So history, the students were given the patient's story and asked to work through it together and then come up with additional questions they would ask their patient. Students were asked what observations they would request on the patient and what equipment would be used to gather these. They then completed iNews charts with these observations for their patients and scored them. For physical examination, students discussed what they would perform and were then given the results of these, which they documented as diagrams and clinical notes. Students selected investigations they would perform and the equipment that they would use. They were then provided with the results of some investigations and asked to put all the information they had gathered together to come up with a differential diagnosis. 8 cycles of the ASK programme were delivered to 220 first-year medical students between January and April 2022. The results of student feedback are overwhelmingly positive. So as seen here, of 120 respondents, 73% strongly agree and 26% agree that this programme helped them to apply their physiology knowledge to a clinical case. When asked how, students stated that the clinical cases gave context to their learning and helped them to understand why it was important. Students commented that working through a case over multiple weeks and meeting patients and clinicians helped motivate them to research and understand more of the impact of physiology on both the clinician and the patient. 63% strongly agreed and 32% agreed that the programme was useful in helping them apply team working skills. So here students commented that the sessions allowed them to hear different perspectives and encouraged them to communicate their own ideas clearly as well as compromise with their teammates in order to make decisions. Students also commented that they liked that the sessions were not assessment driven and encouraged them to explore and seek and share opinions, that there was not just necessarily one correct answer. Some suggested areas for how the programme could be improved included practice of additional cases and incorporation of other science modules. So it's always good to hear people ask for more. Students also asked for more information on procedural skills and how the equipment is used, commenting that videos of the skills and practice of certain elements on one another would be helpful and interesting. When asked what they enjoyed most, the most commonly cited answers were the hands-on and interactive format of the workshops, working in and feeling like part of a team, and having the opportunity to interact with a patient in a way that they could ask questions and build empathy. In conclusion, VEMS is a low-cost simulation modality that promotes high levels of engagement and team-based learning. It is less resource-intensive than full-scale scenario-based simulation. There are decreased risks of technological failures, and it can be implemented by faculty without the need for specific audiovisual or simulation technical training or support. These sessions have demonstrated that this is a modality that allows a very large volume of students to become involved in a patient case and participate in simulation. The programme allows for early patient contact and clinical exposure in the early years of medicine and uses case-based learning to link scientific knowledge to patient care and patient safety. The ASK programme involved a high level of preparation by the facilitators in generation of cases, facilitation of clinician and patient sessions, and preparation for the VEMS sessions. The development of a resource bank and very careful documentation of how the ASK programme was delivered will assist us in allowing this programme to be replicable and sustainable in future years. Although it's a more basic form of simulation, components of psychological safety and transparency are still of vital importance here. Facilitators must pre-brief learners and ensure a respectful and safe environment for learning so that students can engage with this method of simulation effectively. Looking towards the future, our team is currently developing more cases for the ASK programme, which will include stroke and diabetes. We endeavour to have additional patients printed on double-sided boards, representing different age groups, genders, and racial diversity for future cases. We're also developing a series of skills videos which will support students to better understand and engage with the equipment they use. There are huge opportunities for this type of programme to be used in other scientific modules such as biochemistry, anatomy, pharmacology, and so on, and to incorporate input from a very varied and multidisciplinary team, academically and clinically. To conclude, here are some very nice quotations from our student feedback that I'd like to share with you. Ailish and I thank you so much for listening, and we welcome any questions you might have.